Ashley Collins. I'm a registered nurse here in Nashville at Centennial, and I've gone on 3 trips with Health Talents International, all in February. There are many reasons why I love to go on these trips. The first one is, and the biggest one, is just glorifying God through our acts and our talents and the service that we do there in Guatemala. It's very easy through our talents and what we're doing, providing these surgeries and helping people recover afterwards, to let the patients know that we're not doing this for ourselves to show out what we know or what we can do, but we're doing it to glorify God, praying with them, singing with them, and just glorifying God through our actions. I also go for the sense of community that I found there. My family that I go with in February, not my actual family, but my brothers and sisters in Christ that I have met on the trips, have been the most encouraging and supportive people. I've built relationships outside of the trip with them, and it has been a blessing ever since I've met all of them. They continually lift me up and check on me and encourage me in my job as a nurse, which I'm very thankful for. I would encourage anyone who is looking at Health Talents to ask questions and do some research and ask me or anyone else that's gone. It will be a huge blessing in your life, and I pray that you will prayerfully consider going on one of these trips so that you can glorify God through not just your health talents, but also just being a minister for Him, for trying to be like Jesus and washing people's feet and just showing the love of Christ.
My name is Titus Dowk. I'm a pediatric ICU nurse at Vanderbilt, and I've been to Guatemala 6 times with Health Talents International. My first trip was back in 2015 when I went with the MET program, which is Health Talents' summer internship for college students that are interested in doing something medical. I went not really knowing much about Health Talents at the time. I wanted some good medical experience, and I also wanted to work on my Spanish. So I decided to sign up, and I remember talking to a lot of people that had gone before and them telling me how incredible the experience was. And so I didn't really get to grasp that until I went for myself. The MET program it's a 6-week internship where you spend a week in language school, and then you also do 2 weeks in Clinic Hazel and 2 weeks at Chichi, or near Chichi, Castanango. And you get to do mobile clinics with all the people there. But after that trip, I was hooked, and I have been back 5 times since. When I think about the reasons that I go, I think number 1 is there's a need. I've gone several times as a translator, but there's also a need for nurses, for surgeons, for dentists, and even for people that just want to care for people. There's always a need, and there's a place for anyone on this trip. I think also about the people there. I love translating for people because they're always so thankful. Anytime they're thankful about anything. Every time they have a surgery, they're always sure to say thank you. And first of all, they always give thanks to God and say gracias a Dios y gracias a ustedes. And thanks to you all for this amazing opportunity and for this chance for me to have this surgery that I otherwise might have to wait a really long time to have. I can remember one specific story where I was translating for a patient, and he was supposed to have surgery that week, but we were going to have to postpone it to a few months down the road when another team was coming. And so I was the one that got to tell him that. But after I told him, he just said, thank you so much for the opportunity. And he never said anything about, how sad he was or how mad he was that we couldn't get the surgery done. He was just so thankful that we would even take the time to come down and to give him the surgery and to perform the surgery. And so that was really humbling to me. Another reason that I went a lot when I was a student is because I got so much experience from it. I can think of different doctors and nurses that I worked with, Dr. Stephen Harvey, Todd Holt, and Suzanne Simpson, who are all people that helped me with my first IV. Those are all experiences that have helped me so much, and as a nurse, or they helped me as a student and have helped me as a nurse today. And I'm so thankful that I've been able to go and to grow as a person and grow as a nurse. And I think lastly, the reason I go is for the relationships. When I went back in 2015 and did the Met program, I became really close with one of the families in Chichi, and I've been back twice since then, and they're always so happy to see me, and it brings me joy to see them again. But also, not only the Guatemalans, but also the people that we go with. I've been on the August surgical trip 3 times now, and I get so excited thinking about going again. Everyone is so encouraging, such a joy to be around, and I've made some wonderful friends from those trips. And I can't wait to go back again.